Destruction of cyst or lesion iris or ciliary body, non-excisional procedure. The physician places a special contact lens on the eye of the patient. The YAG or argon laser is focused on the cyst or lesion and multiple short bursts of light destroy the abnormal tissue. Destruction of lesion, conjunctiva. The patient's face and eyelid are draped and prepped for surgery. Local anesthesia is administered and a lid speculum is inserted. A freezing probe, cryotherapy, is applied to a lesion on the conjunctiva. No repair is required. Destruction of lesion of cornea by cryotherapy, photocoagulation, or thermocauterization. The physician applies a freezing probe, a laser beam, or a heat probe directly to a corneal defect to destroy it. Freezing is the most common method used for this procedure. The physician applies antibiotic ointment and sometimes a pressure patch. Destruction of lesion of lid margin, up to 1 cm. The physician administers a local anesthetic and the face and eyelid are draped and prepped for surgery. An electrocautery tool or photocoagulation is used to destroy the small eyelid lesion. Destruction of localized lesion of retina, e.g., macular edema, tumors, 1 or more sessions, cryotherapy, diathermy. The physician destroys a lesion of the retina by freezing, cryotherapy, or by heat, diathermy. The physician explores the sclera and sutures are placed under the involves rectus muscles so the eye can be rotated to expose the area to be treated. Sometimes, a rectus muscle is temporarily detached to permit adequate exposure. Cryotherapy and diathermy are performed without entering the posterior chamber. Either probe is pressed against the sclera overlying the site of the retinal lesion until it is destroyed or until the session is completed. Any muscle incision is repaired and any sutures removed. A topical antibiotic or pressure patch may be applied. Destruction of localized lesion of retina, e.g., macular edema, tumors, 1 or more sessions, photocoagulation. The physician destroys a lesion of the retina using a laser or xenon arc. After the patient's eye has been dilated, the physician places a special contact on the eye of the patient. Photocoagulation by laser or xenon arc is performed without entering the posterior chamber. The destructive light beam is guided through the contact into the retinal lesion, which is destroyed in 1 session or in a series of sessions. A topical antibiotic or pressure patch may be applied. Destruction of localized lesion of retina, e.g., macular edema, tumors, 1 or more sessions, radiation by implantation of source, includes removal of source. The physician treats a malignancy, tumor, growth, or edema by exposing it to a radioactive implant. The plaque-like implant is secured with sutures to the sclera overlying the site of a malignancy. At a future time, the physician recovers the implant. The incision is repaired. An antibiotic ointment and pressure patch may be applied. Destruction of extensive or progressive retinopathy, e.g., diabetic retinopathy, 1 or more sessions, cryotherapy, diathermy. Photocoagulation. The physician destroys small vessels that are leaking blood on the retina. Cryotherapy and diathermy may be performed without entering the posterior chamber. Either probe is pressed against the sclera overlying the site of the retinopathy until it is destroyed. With a laser light or xenon arc aimed through a dilated pupil without an incision, the physician may burn spots at the site of diabetic retinopathy to seal vessels that have been leaking into the retina. At least 500 xenon arcade burns Oregon 2000 burns from an argon laser are applied. This procedure is often referred to as scattered destruction. Multiple sessions may be required. Destruction of extensive or progressive retinopathy, 1 or more sessions, preterm infant, less than 37 weeks gestation at birth, performed from birth up to 1 year of age, e.g., retinopathy of prematurity, photocoagulation, or cryotherapy. The physician treats extensive or progressive retinopathy by freezing, cryotherapy, or by laser, photocoagulation, in a preterm infant, less than 37 weeks gestation at birth, performed from birth up to 1 year of age. Performed under topical or general anesthesia, cryotherapy may be performed without entering the posterior chamber. Under direct visualization, the physician applies a freezing probe to the avascular retina. Approximately 50 applications may be required. Alternately, the physician may ablate the targeted area using a laser photocoagulation device. Multiple sessions may be required, although this code should be reported only once during a defined treatment period. Destruction of lesion, except excision, dentoalveolar structures. Electrocautery may be used to burn the lesion, cryotherapy to freeze the lesion, or chemical injections to destroy the lesion. A laser which produces high-intensity light may be used to destroy the lesion. No suturing is required and the resultant surgical wound is left to heal secondarily.
Excision or destruction of lesion of pharynx, any method. The physician uses an intraoral approach to excise or destroy the lesion. Destruction may be accomplished using a laser, cryosurgery, or electrocoagulation to cause the tissue to coagulate. Methods of excision may include avulsion or curettage.
Excision or destruction of lesion of pharynx, any method. The physician uses an intraoral approach to excise or destroy the lesion. Destruction may be accomplished using a laser, cryosurgery, or electrocoagulation to cause the tissue to coagulate. Methods of excision may include avulsion or curettage. Destruction of lesion, palate, or uvula, thermal, cryo or chemical. The physician destroys a lesion of the palate or uvula. Destruction may be accomplished by using a laser or electrocautery to burn the lesion, cryotherapy to freeze the lesion, or chemicals to destroy the lesion.
Ciliary body destruction, diathermy. Cyclophotocoagulation, transscleral. The physician makes an incision in the conjunctiva and through the sclera in the pars plana opposite the site of the ciliary body to be treated. The physician uses a heat probe, diathermy, or laser, cyclophotocoagulation, to burn holes in the ciliary body. The physician closes the incision with layered sutures and may restore the intraocular pressure with an anterior and/or posterior injection. A topical antibiotic or pressure patch may be applied. Ciliary body destruction, cyclophotocoagulation, endoscopic. Endoscopic cyclophotocoagulation or ECP, is used for open-angle glaucoma and narrow-angle glaucoma. In this procedure, the ciliary body of the eye, which creates fluid, is treated with a laser. This reduces fluid production that in turn, reduces intraocular pressure. The ciliary body is a small gland running around the circumference of the eye located behind the iris. ECP is most often performed at the same time as cataract surgery, after the cataract has been removed from the eye. No additional incisions are required. The ECP probe uses tiny, optical fibers to illuminate, view and treat the ciliary body with laser energy. Approximately 20 to 40 laser applications will be administered. Ciliary body destruction, cryotherapy. The physician applies a freezing probe to the sclera over the ciliary body with the purpose of destroying the ciliary process. This is especially useful in aphakic patients. Ciliary body destruction, cyclodialysis. The physician makes an incision in the conjunctiva and sclera in the pars plana adjacent to the portion of ciliary body to be treated. The physician passes a spatula through the incision and into the suprachoroidal space of the anterior chamber. The spatula separates the ciliary body from the scleral spur. This may result in a lowering of intraocular pressure by a decrease in aqueous humor formation from the now detached ciliary body or by increasing uveovascular scleral outflow of aqueous. The physician closes the incision with layered sutures and may restore the intraocular pressure with an anterior and/or posterior injection. A topical antibiotic or pressure patch may be applied. Excision or destruction lingual tonsil, any method. The physician removes or destroys the lingual tonsils. The physician uses an endotracheal tube or an operating laryngoscope with jet ventilation to ventilate the patient. Using an intraoral approach, the physician uses a laser to destroy the lingual tonsils. Transurethral destruction of prostate tissue, by microwave thermotherapy. By radiofrequency thermotherapy. The physician inserts an endoscope in the penile urethra, prior to endoscope placement. The urethra may need to be dilated to allow instrument passage. After the endoscope is passed, a microwave thermotherapy stylet is inserted in the urethra and the diseased prostate is treated with electromagnetic radiation. The treated prostate is examined for evidence of bleeding which may be controlled with electrocoagulation. The endoscope and instruments are removed. A urinary catheter is inserted into the bladder and left in place postoperatively. Destruction of internal hemorrhoid, S, by thermal energy, e.g., infrared coagulation, cautery, radiofrequency. The physician explores the anal canal and identifies the internal hemorrhoids. The hemorrhoids are destroyed by thermal energy, e.g., infrared coagulation, cautery, radiofrequency. The hemorrhoidal remnants may be removed.